Hello guys, welcome to DanGH and my name is Anita. Today we are going to talk about postnatal examination, and this is one of the link stations. If you watch my previous videos, I did have a quick chat on this particular link station where I did mention that it contains 30 minutes and you are required to do 2 skills within this 30 minutes. It could either be birth, newborn examination and postnatal examination. Our previous video did talk about what is expected of you during the birth skills. Today we are going to talk about the postnatal skills. Stay tuned and I hope you enjoy this section as well. Check all the postnatal examination requires 8 marking criteria. So there are 8 things you're going to look out for through your practicals just to make sure that all these 8 points was seen during your skills. If you are giving birth and postnatal check, it could be that patients may be in delivery suite. However, if you are giving postnatal check and newborn examination, it could be that mother is in the house and you are doing a day 3 postnatal check in mom's house or in the delivery suite, either which. So when you are starting a postnatal check, you need to perform your hand hygiene. As I said, anytime you are approaching the patient, perform your hand hygiene, leave it to air dry, always verbalize each step of the hand hygiene you are doing, and introduce yourself to the patient. You introduce yourself, you confirm patient details, and tell the patient why you are there and what you are there to do. So you are here to undertake, if in the scenario they stated that a day 3 postnatal check, so you are here to undertake your day 3 postnatal check, and I will be doing a head to toe systemic examination of you. Am I good to go, or am I allowed to do? If she gives you the consent, repeat the hand hygiene again, wear your PPEs, that is the apron and your gloves, and start your postnatal check. So with this one, before you start this postnatal check, you need to gain rapport. How do we gain rapport? By reviewing mother's previous examination, by reviewing mother's postnatal notes or mother's history. What went through in your labor? How was your labor? Was it how you expected things to do? How are you feeling at the moment? Inquire about mother's well-being, mother's health. Is mother eating all right? Is mother breastfeeding all right? Is mother in always the good mood, or is mother feeling down? Is mother anxious all the time, or sometimes is feeling depressed? These are some of the well-being questions you need to ask the mother in order for you to pass this particular marking point. If you do not verbalize anything at all, the chances of you failing this particular station is high. Always ask of mother's well-being. What goes into mother's well-being? Is mother sleeping all right? Is mother eating all right? Is mother drinking all right? Is mother having enough rest? Is mother breastfeeding or bottle feeding all right? How is mother feeling in terms of mood? Is mother moody at all times, or is mother anxious all the time, or is mother calm, settled and expectant? These are the kind of questions you need to ask your mother. Usually you find a mannequin, so therefore is the examiner who will answer you based on what you ask the mother. So don't think that the examiner is going to tell you all those things. You need to ask the examiner in order for the examiner to respond to you. So after you have inquired all these things, you need to now undertake a maternal observation. You undertake a maternal observation on the woman, and that goes with blood pressure, pulse, respiration, temperature, oxygen saturation. After you are done with that, you assess mother's breast. If there is any signs of engorgement, or if there is any sore nipple, you can also verbalize it out and ask mother, how do you feel about your breast? Does it feel painful? Does it feel tender to touch? Does it feel sore? Is baby breastfeeding or not? If baby is breastfeeding, how is baby breastfeeding? Is baby breastfeeding all right? If mother gives you the question, all those answers, you can further on ask, are you happy for me to have a feel of your breast? Then you have a feel of your breast. Now, a breastfeeding mother will have a painful breast, so that doesn't mean that you need to do your circular round examination like how you are examining a lump in a woman's breast. So you can verbalize it out, or it is wise to verbalize out that since you are breastfeeding, I'm just going to observe the nipple, the breast, to see if there's any abnormality. I wouldn't want to touch it as you feel pains in it. That is a good point, and that shows that you are being compassionate and kind. This gives you a bonus in this particular marking point. After you are done with the breast, you do an abdominal examination. If mother had a cesarean section, for this particular postnatal check, you check the wound, you check the site if there is any bleeding. If the wound is covered, check if there is anything oozing out, the dressing is clean. If it's a vaginal bed, check mother's uterus, have a feel of it. If it's palpable, is it contracted? If it's not palpable, you need to verbalize it out to your patient. Check the skin and check if everything is normal from abnormal. You then ask about vaginal loss. You don't necessarily have to view it, but ask mother, is mother still losing blood? What is the color of the blood? If ask the mother that how many times has she changed her pad? Has she changed one today before you came in? If not, if yes, ask her, are you happy for me to have a look at your pad? Then you check the pad. The examiner can tell you that assume that this patient has already given you her pad and it is clean. Move on to the next step. This is an instruction the examiner has to give to you. If the examiner does not tell you to move on to the next step, never assume that you are supposed to move on to the next step. You need to ask it, and who knows, the examiner might have even prepared a soaked sanitary pad for you to access. So never assume anything when doing your examination. It's a bonus if the examiner tells you to overlook it and go to the next step. However, never assume. After you have done your perineal check, check the legs. This is for VTE, deep vein thrombosis. Have a feel of mother's calf. Ask if mother is having pain anytime you pass your hand around the calf. Check for swelling of the legs. Check for swelling of the hands. Check if there is clapping of the fingernails. Check if there is edema whatsoever anywhere or any part of the body. Give advice on feeding baby. For example, if mother is bottle feeding, ask how mother is bottle feeding. Is mother sterilizing the bottles before and after feeding baby? Is mother feeding the baby with warm milk? If mother is preparing the bottle feed herself, is mother preparing the bottle feed well? Is mother preparing all those formula milk well for baby to have enough of this nutrient? If baby is breastfeeding, ask, is baby latching on well? Is there good attachment? You can even go further by asking that, can mother give you an example of how she will breastfeed the baby, just for you to have a visual view of what is going on when mother is breastfeeding the baby. These are an important technique. You need to also inquire about baby's poop. What is baby's color of poop today? Is it green, yellow, or brown? Is it watery or is it lumpy? All these gives idea of whatever is going on. Is baby passing urine? All right. Mother might even ask you that my baby's toilet is still green and black. Then, and I'm so worried. That is when you educate mother on whatever concerns mother may have. As I mentioned to you, this is a mannequin. Therefore, it's the examiner who will respond as a patient, and she might ask you all these things. So you should be ready and prepared in whatever point you are given. Once you are done with all these, you need to document all those things you have done and discard your PPs in the infectious waste. Perform your hand hygiene and make sure that this particular station has taken about 15 minutes of your time, so you have enough time to do the other skills. As I mentioned, they are 30 minutes and it is required you do 2 skills in this 30 minutes. It could be birth, postnatal check, or it could be postnatal check and newborn examination. Either which, make sure that you are quick with your documentation and you are quick with your practical. Both will be marked in order for you to pass this clinical station. I hope you've enjoyed the postnatal check, and in my next video we will talk about newborn examination. Stay tuned and have a nice day. Bye.